Cervical cancer remains to be the second most common cancer affecting women. Data from the health department show that more than 7,000 new cases and nearly 4,000 deaths due to cervical cancer are expected yearly here in the country. This May is Cervical Cancer Awareness Month. Let's take a look at the causes, the symptoms, and treatments available from our guest specialist today. We have Gynecologic Oncologist Dr. Carolyn Zalameda-Castro. Good morning and welcome, Doc Carolyn. Thanks for joining us.
Hello, Doc Freddy. Good morning. Thank you for having me here.
Now, for the benefit of our viewers, let's explain to them what exactly is cervical cancer, ano ang mga simptomas ito, telltale signs, and ano kaya mga red flags para malaman na kailangan na magpatingin sa doktor.
Okay, before we go to the cervical cancer, I want to just make the audience know what the cervix is. The cervix is the lower part of the uterus. So the uterus is the womb where a woman, when the woman is pregnant, that's where the baby grows. So the lower part of that is the cervix. Now, cervical cancer is cancer that affects the cervix, that lower part of the uterus. The cause is mainly a virus called the human papilloma virus. It's a sexually transmitted virus. There are two types. One is the low risk and one is the high risk. It is the high risk type of HPV that causes the cervical cancer. Now,
okay.
For the go ahead with
yes,
all
go
of
ahead.
your questions,
Go ahead, Dr. Carolyn.
For the symptoms, unfortunately, in the early stages of the disease, it is usually asymptomatic. Tridor, that's what we call it. Tridor na sakit, because at the early stages, it does not manifest with any signs and symptoms. Later on in the disease process, when the stage is higher, that's when patients present with symptoms of bleeding, vaginal bleeding, coital bleeding, bleeding after menopause, all kinds. They can also experience pain, sometimes weakness, difficulty of breathing, especially when the lungs are already involved, difficulty in urination or in passing out of stools, especially when the tumor has already spread around its adjacent structures like the bladder and the bowels. Sometimes a woman would also experience edema or enlargement of one leg or both, especially if there's already involvement of the circulation of the blood.
Okay, now let's talk about, Dr. Carolyn, kung anong age group ang most at risk for cervical cancer?
Age group most at risk is 40 to 60 years old. However, we see this type of cancer even in the young-aged woman, like in the 20s, unfortunately, because it is caused by a virus. So it depends on how early they have started with their sexual intercourse. That's when exposure starts. So sometimes we do see them at an early age, but the average age at which this is usually diagnosed is between 40 to 60 years old.
Okay, let's talk about that a little bit because this is caused, as you mentioned, by the HPV virus, which is linked to cervical cancer. Now let's talk about what can women do? Is there a change in their lifestyle? How can they prevent this from occurring? How can they prevent HPV from affecting them?
Yes, doctor, we know that there are 3 levels of prevention for all diseases. It also applies to the cervix, to cervical cancer. So for primary prevention, that means we avoid getting the HPV so that we avoid becoming sick of it, or we avoid getting infected. So lifestyle modifications like avoiding having sexual intercourse at a very young age, if possible, having a mutually monogamous sexual relations with your husband, so only one, and hopefully the husband will have only the wife as the sexual partner. Avoidance of getting pregnant at the early age, avoiding multiple sexual partners, and of course, this can be prevented by having vaccination because there's already the HPV vaccination. This is usually given at the age of 9 years old, starting 9 years old, when there is no exposure yet to the virus. So that's for primary prevention. Secondary prevention is trying to detect the disease at its pre-malignancy before it becomes malignant, so that intervention can be done to prevent it from turning into a malignancy. And that is what we call screening. Right now, available screening methods are The one that is recommended by the World Health Organization is the HPV DNA testing,
Okay.
because this, as we mentioned, this is caused by a virus. So there's a test that we can do to detect for the presence of that.
That's right.
We also have pap smear.
Okay,
Yeah, we
so
do
all
have
of those,
pap smear
if our viewers,
where
Doc Carolyn, has any other questions of this, it's best to talk to their pediatrician if they fall into that age group, or to talk to their OBGYN for further understanding on prevention of cervical cancer. Thank you once again, Dr. Carolyn, for joining us this morning here on New Day.
Thank you. Thank you so much.